Hello, hello, and welcome. Make sure I'm not going to cut my own head off here. Perfect. Thank you for joining me today. I'm just going to share this in my group. I hope you guys are having a good start to your week. Joining you a little later today. Just a sec here. Okay. I am live in Facebook land, so I'm going to switch this over. Nobody likes looking at themselves on camera. Perfect. Okay, well, if you are joining me today, thank you for doing so. If somebody could on the other end let me know if they see and if they hear me. I am using a new microphone today, so hopefully I'm coming clear on your other end. Hello, Michelle, welcome. You just got your plate yesterday, so you're brand new. Awesome. Michelle, let me know if you can hear me on the other end. I can see all of a sudden a bunch of people joining me. So I think there's about a 1-2 minute delay from when you'll see me on the other end there. So thank you for your patience while I share this out. I like to share this to the VIP group. So if you are joining me from the VIP group today and you would like to comment at the end of the session or you have a question for me, make sure that you're in the main Life Pro page. That's where you're going to see, that's where I'll see the comments on my end rather. So be sure that you are there. One more share, join. Okay. Perfect. So today is about back, neck, and spine hacks. There's lots of different reasons you may be dealing with a back issue. Diane, perfect. I'm glad I'm coming through. I'm using a new mic. I feel like I'm like Ariana Grande or something, even though I'm not. So there's that there behind the scenes, and I think I muted myself. So today is not so much a full routine. I know many of you are in different areas of concern when it comes, maybe it's low back, maybe it's between the shoulder blades, maybe it's the neck, maybe you're dealing with spondylolisthesis, maybe you're dealing with, I just did 2 calls back to back and I'm tripping on my tongue for spinal conditions. I deal with a lot of pediatric spinal post-surgery stuff, so I'm really confident and I'm really comfortable in speaking on today's topic. And if you're dealing with anything back related, 9 times out of 10, especially if it's a flare-up, the biggest thing you got to remember is modifications. Modifying what you may have been doing on the machine to accommodate where you're at right now. So whether you're dealing with total back issues, neck, no sound now, I can hear you, but left and came back. Can you hear me now, everybody? Me and my it was because I was showing off my mic and I disconnected it by accident when I was showing off. That one looks to be working. Okay. Michelle, just let me know one more time if you can hear me on the other end, and I'll start getting into my ramble. So I'm going to start with some position ideas today. Awesome. Thank you so much for letting me know, Diane. And what I'd like to do at the end is leave lots of time for questions if you do have something specific. And anything that comes out of my mouth today, I come from a very experienced place of using vibration plates for many, many chronic issues, 9 times out of 10, you are not dealing with just one thing. So we're going to try and keep today's questions more specific to back, but like any chronic issue, you are always in control over the intensity. Your experience is absolutely driven by a couple things: your tolerance, how you're feeling right now, and what we do on the machine as far as positions and the settings we do those at. So I'm going to, I just want to be a little taller. There. I have a couple of mobility aids today. I haven't used my cane yet this year. I usually use my ladder. So I thought I will try my cane today. And depending on where you're physically starting at, you may or may not be comfortable standing on the plate just yet. So we're going to start, everybody's going to start today with a little bit of just a seated warm-up. And as always, I am using oscillating movement. If you are working, oh, did I not turn my machine on? I always do that. If you are working on a multi-moving machine, oscillating movement is your default or your first setting as soon as you turn the machine on. If you're working with a Waver or a Mini, or one of the hex plate models, there's a few. Singular moving oscillating. Oscillating is the main movement. It most mimics how we walk. And when you're dealing with back and spine issues, regardless of what program, what speed, oh, Debbie, I like this, I don't like that. When it comes to a flare up with your back, or maybe it's a new thing with your back, or maybe it's a chronic thing with your back, reducing the amount of movement or the amount of impact is the one control I want everybody to understand. And I always ramble at the beginning of my sessions. So wide feet, that jogging indicator, is the most impact. Closer is less impact. And for spinal issues, neck, hip, there's really, when you stand on a vibration plate, and sometimes even when you're seated, there's really no way you're not moving your spine ever so slightly. So I want you to start in a place of being conservative on your intensity. So the heels drive the movement. So you can even put your feet in a little bit of a V. So the heel of your foot is about 2 to 3 inches apart, and you're just slightly like this. I would suggest a mid-speed range, and here's why. This is not a treadmill. This is not an elliptical. So before we get into the specific moves, I just want to have a very clear understanding on the settings. Yes, I said mid-speed. Mid-speed is smoother. It's less choppy. Slower settings in oscillating, slower programs, slower speeds are very choppy. They're very destabilizing. They're very much like being on a Bosu ball, but with more consistency. So when you're dealing with spinal issues, neck, hips, back, whatever is the issue, if the more time your body has to sway and guard and protect, the more we tend to tense up and resist the movement. And what I'd like you to do in complement with closer feet, because we're reducing the amount of movement we're exposing our hips, our back, our spine, our neck to, bring it up a little faster, and you're going to feel it's more soothing, less choppy. So the first exercise I would like you to try, if you're in very, very severe back pain, you may or may not want to stand. Maybe just seated like this is as comfortable as you feel doing. This is still going to give you some circulation, some lymph, a little sense of, let's call it euphoria, some relaxation. When you're in pain, it causes stress and mental anguish, and sometimes just a little bit of movement is going to help. If you do feel comfortable standing, how I would like you to stand is keeping in mind we want those heels close together. Those knees are slightly bent. And if you're standing tall like I am, you're going to feel slight movement already in the low back. So we're going to start from the bottom and kind of work our way up. So let's talk about how we target our low back. There's a million ways you can target your low back, but a lot of it may require range of motion and getting down on the ground or sitting on the plate. So we're going to start with the assumption that things are pretty bad. My back's hurting. How do I fix my back, or how do I target my back in a standing position? So simply keeping the knees slightly undone, I would like you to lean forward with the hips. So you're at about a 45-degree angle. And just by changing the angle of how we're standing, the legs are just undone, but get them as straight as possible. Instead of going from here, where the load is being absorbed by the quads and the hamstrings and the glutes, by leaning forward, you'll feel the movement shift to the top of those hips, up into that low back. Hang on just a second. Okay. You're going to feel it in this area. Now, perhaps this feels too intense or it's still quite painful. Stand up. Bring your feet dead center. Now try. And you feel you're in control. Okay? If this is not tolerable at a mid-speed with your feet close together, you need to consider other options. I don't want you going like this for 5-10 minutes thinking it's going to make you feel better. Listen to your body. If you're feeling sharpshooting pain, there's more going on. Go see your doctor, your PT, your chiro, your go-to guy. But if it's just muscle tension, it's that chronic old injury coming back, and this feels comfortable, I would like you to start adding a little bit of movement in the hips. 2 ways. We're going to do a bit of a pelvic tilt, if you will. So we're going to tilt the bum forward, clench those butt cheeks, and you should feel a little bit of a stretch. Okay? Then we're going to come backwards. We're going to tilt the bum back this way, and you'll feel a slight stretch here. If you have issues kind of one side more than the other, I encourage you to swing your hips just slightly one way or the other while you're doing these exercises, okay? It's a means of sending the vibration to the area that needs it, okay? The more you wiggle around and experiment what feels good for you. And in this position, we're just getting some blood, some circulation. We're relaxing up those tight muscles, okay? One variation I'd like to show you, perhaps you're a little fearful, perhaps you're a little scary, and these moves that I'm doing just aren't for you right now. Give yourself something to hang on to. So I have several stools. Maybe this is why I like a swivel stool, because then you got a handle right away, okay? If this is feeling good, we're going to move up the back a little bit now, okay? We're going to lean over. You can put your hands on a bar height stool. You can lean your forearms on the back. A taller stool. Play around with the furniture you have at your disposal and see what feels best. My fave is putting my hands on the seat of the stool, maybe coming up on my fingertips to get a little bit taller. And you're going to feel the vibration is now a little bit more mid-back. And if you push your bum back just slightly or slightly forward, you're going to feel it go from that tailbone up, just slightly changing your angles, ever so slightly. Okay? If you're dealing with back issues, I like having a chair to sit down. If you ever decide you're done and you need to take a break, you can just sit down. Okay? So let's try that same variation we just did, but at a different angle. We're going to tilt the hips forward, almost like a cat-cow. Well, it is a cat-cow. You're going to feel a nice stretch here. We're going to come back this way, like we're trying to touch the back of our head to our tailbone. Okay. Again. Okay. If you are using this primarily to target symptoms, relieve some pain, 2 to 3 minutes is all you need. And you can use something like that, as symptoms may crop up throughout the course of the day. Maybe you're doing this as a warm-up before you do your other routine. If you're dealing with a troublesome back, there's kind of a fine line between I'm treating symptoms because I'm having a flare-up or I'm having issues, and I'm working out or I'm maintaining and doing those type of things. So if this is offering you relief, or you've used your vibration plate in other ways to relieve the back, keep doing the work that you were doing. You don't want the problem to come back, okay? So we're going to resume a little bit. I want to talk a bit more about other things before we get on the ground, because we are going to get on the ground. In a seated position, I forgot to mention, because we are going to, I wanted to geographically work, but it's not going to work that way. We're going to start with some seated exercises. But if you want to target the shoulders or the neck, I've shown this variation in a mazillion bazillion sessions for Life Pro. The big difference if you're dealing with chronic neck and shoulder pain, bring the feet closer. Reduce the amount of movement. Okay? Add some movement. Roll the shoulders. There's all kinds of things that you can do, and all you're using the plate for is to add a new level of stimulation to target it further, get relief quicker in less time. If any of these positions, if you're dealing with degenerative disc, neck issues, all of these things are not contraindications, but you do need to pay attention to your level of comfort, your tolerance. All a vibration plate is movement. It's activity. And what you don't want to be doing is resisting and fighting it. A lot of times it's our own bodies, that guard and protect. And subconsciously when we're doing exercises, especially with my ladies, when we get it into the neck and the shoulders, we guard and protect. So if you feel like your teeth are chattering, just relax. Maybe do some breathing exercises. It's not about fighting and resisting the stimulation that you're feeling. Okay? So we're going to get on the ground for a few variations now. Let me get my chair out of the way. Okay. So if range of motion allows you to get down on the ground, there's a couple different ways. We're going to start with some upper body for the upper part of the spine, where we're going to get into the neck and the shoulders. Why is a vibration plate, a good activity when you're dealing with back, neck, and spine issues? Well, it's low impact, and generally when you're dealing with issues, intricacies in this area, impact is not your friend, nor is things like high intensity, long duration, those types of things. So not only does a vibration plate substantially reduce the amount of impact, but it reduces the amount of time that you need to spend if you're doing physical exercises. So first example is going to be, let's target the neck and the shoulders, and we're going to do it in a girl style push-up. And all that means is we're going to reduce almost to a nil the amount of body weight that we're incorporating into this. So we're going to use the plate to get some movement, some stimulation into these areas, but we're not going to do it in a fitness position where we're also, having to build muscle and hold ourselves up. I want you getting relief, and you can progress to strength and other exercises when you feel ready. So just like when you're standing, wide hands, more movement, more shake. I want you to bring those hands closer to the center. And a big tip when you're doing upper body, so we're completely in a box. The majority of the weight is on our knees. We're going to put our hands no more than shoulder width apart. If this is scaring you already, bring them closer to the center. Now, the biggest trick with upper body is putting your shoulders in line with your hands. Instinctively, we want to just look straight down and our head is positioned above our hands, but that's when you get the most head movement. Not that it's harmful, but that's not where we're trying to target, and it's a good way to minimize the head vibes. I want you to just lean forward far enough, and you'll feel. You go further, you play with your angle on this, and you're going to feel the movement and where your body's experiencing it change. We're going to use the same mid-speed range because it's smoother, more tonic. We're going to get more done quicker. We're getting more movement in less time. Okay, so we're going to lean forward slightly. Okay, I want you keeping a nice, good core. You should be feeling it anywhere in the region of the neck and the shoulders. And I just want you focusing on good breathing. Elbows are slightly bent. Okay. If you feel comfortable, this feels kind of nice, you feel like doing a little bit more, maybe we, get some movement in the neck. Okay, so let's turn like when we were seated. Side, side. Maybe we do some shoulder rolls. Experiment. If there's exercises you're doing now or stretches you're doing now, there's all kinds of things I do when I'm sitting at my desk. All we're doing is adding the stimulus of the plate to get more effect, more relief in some cases in less time, okay? So that is the neck and the shoulders. I want you to experiment with this one. The biggest difference between this and fitness is how hard it is, okay? If you're ready for this, great. But if you're dealing with chronic neck and shoulder pain, you shouldn't be on your toes yet. Get some relief. Target these areas from a symptom management perspective, maybe even as a warm-up before you get into those types of exercises. So the next one we're going to do is kind of a taboo position for me. I don't like it. I never do it, especially when there's a word called plank that many of you like to talk about. This is not a plank. I do not like putting forearms on the machine. There's just too many ways that the technique goes out the window, unless you are doing good plank work on the floor now. But placing the forearms on the plate to get relief a little deeper into the upper back, the shoulder blades, and the neck. You know, maybe you've got frozen shoulder. Maybe you've had shoulder surgery. Maybe, you know, regardless of what brings you interested in this session today, there are no contraindications. There's no medical conditions other than if you've had something recent, you know, you probably should make sure that you are cleared to resume activities before you do direct positions, upper body specifically on your plate. So have those conversations with your therapist, your care provider. But if you are well beyond recovery, you know, these are just old injuries you're dealing with. You're looking to move some lymph. You want to deal with some tension. You know, you've digressed in strength. There's all kinds of reasons that motivate you. But, you know, you kind of like it or you don't. So this is a position to try, similar to what we were just doing. You're going to get more head shake, I guarantee it. Oh, notice I added a mat. When you're putting the elbows directly on the surface, depending on the type of plate that you're using, they all have different surfaces. You all have different sensitivities. You may want to mat up, as I call it. And with your elbows, with our hands, I suggested we what? Reduce intensity. You're always in control. Bring those hands closer to the center. Same goes for this. Elbows. This is where planks go wrong on vibration plates. As we're moving, we tend to roll out and our elbows become very, very far apart. Bring your elbows closer together. Make sure they're at least no more than your shoulder are apart width. Closer if possible. This is therapeutic. So if you can bring your elbows right close to the center, it's a nice little stretch. You'll feel right down on the top, out to the edges. And I just kind of rock forward, backward. We're just on our knees. Very little body weight going into this. This isn't about making it a hard, load-bearing exercise. If that feels okay and you want a little bit more intensity, maybe widen up the elbows a bit. I'm still doing this at a mid-speed. I'm at 35 of 60. I always speak in ranges because I want you mixing it up from week to week. I love how this feels in my shoulder blades. So another one I like to do while I'm in this one is I just drop the shoulder blades like I'm trying to touch them together, and then I push up. Just go through or do some circles, get some movement. And I think you'll find if you're doing other things while you're doing these positions, you don't notice the head shake as much because you're distracted with other things, okay? The very last one I kind of want to show you, it's a common question that I get, and it's one of those positions that's universal for many, many things. When you're dealing with spine issues, low back, neck, sometimes people think it's a bad idea to sit on the plate. Well, why? Why is it a bad idea to sit on the plate? It's not, but it is also one of those areas you want to understand your tolerances and why you're sitting on it. A lot of my folks with backache issues do like to sit on it. It's just a real lazy way to get some relief into the low back, all the way up the spine and the shoulders. You know, some of you are working on incontinence and constipation. Some of you are working on toning, and you just happen to have back issues. So it's a question. So if you're sitting straight up, you're going to get a little bit more head buzz. The hips and the legs are moving, but when you're sitting properly on the plate, dead center, you're actually getting very little movement to the spine. very minimal. If you're finding you don't love the head shake, you're a little sensitive in the neck and shoulders, you're not quite used to it yet, because that's all it takes is just some time getting used to it. Just lean forward slightly. 90% of it dissipates. Awesome on the hips and the low back in particular. I like to go through a range of motion where I arch and I go forward. And you'll feel a stretch in the hamstrings on this one. And then I tilt the hips forward. Perhaps you got a little bit of tension on one side more than the other. Okay. My nose is itching. It's the glasses. So the last variation on this one that you can use to target more into the shoulder blades again and the neck, take your hands, tuck them, palms down underneath your thighs, just where the top of the thigh meets the butt cheek, under there. This is a great way to start getting more movement into the arms. This is a great idea if perhaps you've got a really bad issue in the neck or the shoulder and you can't really sustain and do some of the modified push-ups that I was doing. This is a great way to get started. If you've got carpal tunnel, if you've got arthritic hands, there's a million different reasons I like sitting on my hands. If this is okay and you want a little bit more intensity, ever so slightly push into the plate, like fight it a little bit, and you'll feel the intensity into the neck and the shoulders more. How much into the neck and the shoulders depends on the angle that you're seated at. So seated taller, you're going to get more shake. Leaning forward, you're going to get less. Experiment with that. If you can tolerate it, and once you develop the ability to, I love doing neck rolls, shoulder rolls. Okay, you are only limited by your imagination and your range of motion. And if your range of motion is affected by a bad low back, spine, or neck, typically there's probably some exercises and some stretches that you're supposed to be doing now anyways. The plate would be a great way to ramp up the benefits of those exercises, reduce the amount of time that you have to spend doing the exercises. And, if you're short on time like me, you can get your self-care and your workout kind of in the same session. So lots of different reasons. This is just a few small examples. I didn't even cover stretching, but I do want to get into some questions. And any of these could be, just a standalone thing that you're doing because you've been sitting at your desk too long, or you came home and you've had some tension build up throughout the course of the day. So, and really just pay attention. If you are dealing with chronic or acute issues, listen to your body. There's no reason you can't use your plate multiple times throughout the day. Let the symptoms drive when you use it, but keep those sessions very short, very purposeful, 2 to 3 minutes. We're not talking about a big workout here. Okay. So who's with me today? Hi, Vicky. Wanda, Bernadette, hello. Who else is here? Overlay. I see Joe E. Am I supposed to call you Joe or Joe E? You never know on Facebook. I see Gail. I see Lisa. I see Michelle. Ooh, there's lots of you here. Okay, well, it's time for me to stop talking and time for you to start talking. If you have any questions that you would like me to answer, I would like you to invite you to jump over to make sure you're on the main Life Pro page, the event there, not one of the ones that I shared. So go into the live and make your comment in that, not in the share that I posted in the groups to let you know here. I'm going to go back down, make sure I said hello to everybody. Wanda, Bernadette, Vicky, Donna, hello. If you do have any questions, please let me know. If you're watching this on a recorded basis, or if I've maybe rambled and set you into some slumber, always tag me at Debby with a Y. That's the best way to make sure that I will get a notification that I was tagged. So I'll get those. Sometimes Facebook doesn't give me all the information that I would like. So make sure that you tag me if you have something specifically that you'd like me to get back to you on. If you have back issues, a really good investment is a bar height stool. There may be times where you're using it seated or need to take a break and be seated. So those are all signs that, maybe you need to look at some furniture. There's all kinds of options on Amazon. We're getting into garage sale season where I'm at. Something that's going to sit you at a good 90-degree angle. And you can incorporate that with your workout, whether you're using it seated or leaning over like I did in some of the beginning exercises. Where can we access other content for your Life Pro? William, I will drop my personal link. I've got well over 200 sessions with Life Pro. I've got a spreadsheet of all my Google stuff that I'll send over to you after I get wrapped up. And I also have a list of my own personal sessions. I've been a vibration plate specialist for quite some time. So some of the stuff coming out of my mouth contradicts the manuals and what everyone else is saying, but do understand. And I recognize not everyone's coming from a place of being physically fit, or perhaps you've had a setback or a surgery in your life. And there's lots of ways that you can use your plate. There's really very, very few contraindications on my list. But a lot of that comes with just the experience that I have and have been blessed to obtain over the time. And I support a lot of very qualified medical professionals and facilities using the plates for anything from research to rehab and chronic things. So I'm blessed that Life Pro allows me to share my ramblings with you. And, sometimes change, the human element, we all fear change to a degree, and a vibration plate shakes a lot of things up, whether that's physically, emotionally. There's a lot of things that happen when you're using a vibration plate. And if you are dealing with chronic issues, you've got sluggish lymphatic, nothing is better for the body than movement. And in a lot of cases, if you've digressed to a point where you can't be active, just getting moving can be so beneficial. And this can do this even when you can't move yourself. Christina says, any suggestions for the thoracic area, mid-back? Is that a tension-related thing, or do you have an injury there, Christina? Let me know a little bit more. And if it's something that you're dealing with right now, let me know. Lord says, hi, Debbie. I own the Mini. I always use socks while using the plate, and I notice little red dots on my heels. Is that normal? You know what? The little red dots, the Mini's got little polka dot surfaces, so that's probably just the surface of the plate poking into your foot. It's totally a tolerance thing. I've got some of these meditation mats with spikes in them, and I've got marks on my back for hours after using it. So it's a comfort thing. If you're diabetic, if you're dealing with any neuropathy, anything like that, sometimes you want to add a little cushion. You want to make sure you're not rubbing. And if you're just starting out, Lords, make sure that you're not taking on more intensity. If you're fighting the machine to stay in place, you're probably standing wider than you need to. Think more functional. Bring those feet closer together. My feet have imprints on them when I do this, because I do all of my sessions in bare feet. But I tend to change my foot position around. So if I do have any markings, it's usually when I've added some weight or I'm doing positions for long periods. It should dissipate over time. It should go away within a little bit of time after your sessions. If it's more than that, let me know on that one. Christine's not getting back to me, but any suggestions for the I'm kind of, what I guess I'm looking for, Christine, is, are you looking for a relief thing? Are you looking for a strength thing? I like doing hyper extensions for that area. But it depends on whether you can get down on the ground or not. So I'm going to give you two options. Christine was asking about how to get mid back here. Let me see. So my favorite way, I was showing you this one where you lean in to get into the lower back. Bring your stool a little closer and purposefully come down. So you're lower. Your elbows are lower than your hips slightly. If you feel comfortable, all I want you to do, if you feel stable, ditch the stool and do it this way, is slowly roll up until you feel it hit that. I know you say mid-back, but only you're going to know where the spot is. So this is one way. And then I kind of arch, do another rep, and come back down. Just get some movement in that area. Two seated options. The first seated option, I'm sure this is called something, but it escapes me as to what. All of these are at a mid-speed. Yes, they are. Put your feet flat on the plate if you're able to sit. I do not have a mat, but if you have a bony little butt or a hard surface, you may want to put a mat and give it some padding. Take your arms, if range of motion allows. Loop them underneath your legs. Grab your ankles. Hang on for dear life. And pretend like there's strings attached to my mid-back and some puppeteer is pulling me. You're hanging on with your legs and it's like pulling your arms out of your socket. I don't know how else to describe this. Relax. Pull and hold. 2, 3. Relax the head on this one. Come back up. This is my favorite way to do it. Okay. For range of motion the other way. I could do this all day. Hyperextension is my fave. So hyperextension. Uh-oh, I knocked my legs off. If you have sticky outy hip bones, add a mat on this one. So I'm going to get on the plate with my thighs and just the lower part of my tummy. If you do not have the Aeroflex step, which is what I'm using to hold my upper body up, you can use your forearms. And all we're going to do is we're going to arch and we're going to, like we're skydiving. I want you to try, this would be advanced, lifting up. But I want you to just, the starting, lift the legs ever so slightly, or start by just lifting, coming up on your arms, looking straight forward, relax. If you feel comfortable, add both. But I don't want you straining yourself, Christine. Like this. Like the Little Mermaid movie. That's what I feel like when I'm doing that one. All right. I hope that helps, Christine. Just ideas. And because I walked away so fast. Okay. Sometimes it does that, Nancy, because I walk away too quickly, I think. I'm not sure. The internet. So I hope that made sense, Christine. And it's easy to overdo that last one. So don't push beyond your range of motion. Make sure you're breathing. And if there are exercises that you're supposed to be doing for that area of the back now, or things that you've maybe tried in the past that have worked good for you, some stretches, the plate is just an environment that adds more benefit to those things. So usually there's a way you can modify even a position and incorporate it onto the surface of your plate. It's certainly funner, if that's a word, but again, you're going to get a little bit more benefit, a bit more bang for your buck. And I'm short on time. A lot of times it's, self-care takes time. So anything you can do to keep the maintenance and the improvement piece going without it being a big drag is great. Who else is here? So yes, everyone was saying, sorry about the blurry there, guys. I hope that helped. Vicky was asking about the thoracic as well. I think you saw those moves. Vicky, I think you've got the range of motion to give a few of those a try if you'd like to. What else have we got here? Replying. Well, I have rambled about 40 minutes away of your day. This is one handful of just a few examples of things that I've done a few different back sessions. And if you look through my list of sessions, which I promised to post, who asked me? I'm forgetting your name. Lords. No. Willard asked me. I will post my list of sessions, and you can't do all the moves all the time. It kind of defeats the time thing, but those are just some examples. And if your back pain is severe, often there's a lot of ways that you can use your plate to just gain some relief, but be modest on your time. 9 times out of 10, if you are having a flare up or you've had anything occur with the back, neck, or shoulders while using your plate, it's related to too much intensity, too much time, or a combination of both. So be conservative. Don't just assume that it's going to be your big old workout. Reduce those feet, reduce time, and use it for spot treatments and symptom relief. It's a very, very viable tool. I'm going to leave it at that. Again, if you do have questions, tag me at Debby with a Y, and I'll get back to you. Of course, there is a sale on at Life Pro, up to 50% off on select items. Lots of the plates are on sale, maybe not 50% off, but there's some really good deals to be had. So be sure to check that out. I will drop a link to Life Pro site as well. I want you to have a great rest of the week. I will see you next week. It is Cerebral Palsy Awareness Month. And Willard, I'll be live again next, I think I'm scheduled on Monday. It's National Cerebral Palsy Month. Cerebral Palsy Day is in October, but I have a large group dedicated to special needs pediatric, specifically many dealing with cerebral palsy. So I look forward to seeing you guys next week. And if you like the later time, can you make a comment? I see that there's quite a few of you here. I went at 7 p.m. this evening. I've been doing it earlier during the day, but I'm not sure how often life gets in the way sometimes during the day. And I don't want anybody playing hooky at work. So if you like the later time, I'm totally flexible. I can do 7 p.m. again next week. For those of you that found a later time better for you, I just noticed that there's a lot more viewers tonight than I may normally see during the day. Let me know if the later time is good. I will continue to be later because I want to be here for as many of you as I can. Hi, Kristen. Nice to see you. Okay, yes, this is a great time. So I think so too, Christine. All right, yeah. Let me know if you like. I could even go an hour later. In my world, I am on Mountain Standard Time. So for me right now, it's only 5:45. So if you guys do like a later time and you want to hang with me on Monday nights, I'll set my sessions up a little bit later on, and I do appreciate the feedback. Thank you so much. Later is better, Nancy, Willard. Perfect. Okay. Anybody who has been here, if you give me your feedback even after I wrap up the live, and then I can sort of tally. And if it looks like a majority, then you can see me next week at the same time. I'm happy to adjust my times. I love seeing you guys, and I look forward to seeing you again next week. Don't work too hard. Have a great rest of the day.